Do you suffer from hay fever? Today I'm going to cover your most Googled questions on hay fever. I'm Dr. Arshad, an NHS-based GP in Manchester, and I'm on a mission to make evidence-based medicine available to all.
How can I tell if I have hay fever or a cold?
This is an important question. How do you know if it's hay fever or a cold? Now, there's some clear differences between a cold and hay fever. Firstly, you only get itchy eyes and an itchy throat with hay fever. You don't get that with a cold. Secondly, if you do have mucus with hay fever, it's normally clear, watery, runny, but in a cold, it's normally thick and coloured either yellow or green. Moving on from that, with a hay fever, you don't normally get aches and pains throughout your body, but with a cold, because it's a virus affecting your whole system, you can get those symptoms of muscle aches and pains and feeling really rotten. Also, how long does each one last? So hay fever can last days, weeks, up to months, depending on the season and also what your body's reacting to. For instance, if it's seasonal and it's tree pollen or grass pollen, it can last for the duration of that period. However, a cold only normally lasts 3 to 10 days.
When does hay fever season start?
Hay fever doesn't just start at a particular season. It depends what's causing your hay fever. So at the earlier part of the year, from about March to May, it's going to be the tree pollen, so birch, ash, oak. That's where people who suffer from hay fever from trees, that's when you're going to start noticing the symptom. As we move along, from May to about July, you have the grass pollen, which can trigger your hay fever. So freshly cut grass and walking through parks will trigger your hay fever symptoms in this time period. And if you're getting hay fever later on in the year, that'll be from weed pollen, and that can go from July all the way up to September. So it depends on what triggers your hay fever. Usually it's not all three. It's going to be one or two of these hay fever pollens that's going to cause your symptoms. Worth mentioning that warmer winters or warmer springs can cause hay fever to come on early. And a pro tip for you, if you search for birch pollen on Google, you can find out the count and you can predict if it's going to trigger your symptoms, if that's what sets you off.
Can you test for hay fever?
I understand why people might be asking this question. You're trying to work out what's causing your hay fever, why are you getting triggered with these symptoms, why is it ruining your life? Actually, there isn't a test to find out what type of hay fever you have. What you could do is see what time of year it's happening and then work out what could be causing it. So if it's a bit earlier in the year, it's likely to be trees. Middle of the year, it's more likely to be grass, and later in the year, it's more likely to be weed. However, the treatment actually remains the same for all three, apart from one thing. If you know what's causing it, avoid that thing. And we'll talk about that a bit later on in this video.
Is hay fever worse this year?
I can see this question being asked quite a lot online. And I guess that's what's triggering your hay fever and when it's triggering your hay fever. So is it worse this year? How do you work out when a hay fever can be worse? The main points are if it's been a warmer winter and a hotter spring. Those things bring on the pollen count a lot higher. If you're unsure about your risk of getting hay fever on a particular day, just Google pollen count today and your area name. So pollen count today, Manchester, and you'll get a breakdown of tree, weed, and grass pollen, and you'll find out what your risks are for getting those symptoms. If you want to find out if the pollen count is particularly high today, just check out this website. It'll tell you what you need to know and what's likely to trigger your symptoms.
Can you suddenly develop hay fever later in life?
I like this question. This is because some people think if they go through the early childhood and teenage years and they don't get hay fever, that they're in the clear. Unfortunately, it doesn't work like that. Changes in your body environment, if you had illnesses, gone through pregnancy, you've developed some new conditions, can make you more prone to hay fever because your immune system changes with time. Also, if you change areas, you move to an area where there's more grass or more trees and the pollen count's a lot higher, you could get hay fever. So yes, you can develop hay fever at any point in your life.
How does hay fever affect exam performance?
So you're a student, you're waiting to sit your exams and you don't want anything to affect your exams. Hay fever can really ruin that flow, can't it? You can get a blocked nose, your face can feel congested, you've got a stuffy nose, your throat feels itchy, you can't focus, you can't concentrate. It can really impact your exam performance. The key thing here is avoiding your triggers before you get to the exam hall. So simple advice I'm going to give you just a bit later in this video is how you can reduce that risk and improve your exam performance.
Does local honey help hay fever?
Look, I love honey, and I use honey in my tea and a few other things. Now, as a doctor, I can't really say if honey helps with hay fever. That's because the clinical studies actually haven't shown an obvious evidence base that backs this. However, honey does help soothe a sore throat, and also the power of belief is real. So the placebo effect, if you believe something's going to help you, the likelihood of it helping you actually goes up. So if honey helps with your hay fever, go for it.
What can I use for itchy hay fever eyes?
So itchy eyes are one of the worst symptoms of a hay fever. What can you do to stop those symptoms? So some patients say they'll splash their face with cold water or dip their face in water. I guess that can help a little bit because what you're doing there is trying to wash away the pollen that's around your eyes. The other things that help a lot more, using a bit of Vaseline, putting on your eyebrows, that can trap the pollen, stop it getting into your eyes. Another thing that stops the pollen getting into your eyes, sunglasses. The bigger, the better. Just the pollen has to work harder to get into your eyes. Now remember, it's the pollen that you want to avoid to stop these symptoms. So if you can avoid that park, go away from the trees, stay in the non-scenic route, go down the pathway, that will be better for you. Now wait, if you happen to live in the middle of a park or near the woods, you can't really do that, can you? What you can do is go to your local pharmacy and they can prescribe you some allergy-related eye drops, and that will really help with your symptoms.
What is the best hay fever relief?
The best hay fever relief would be to just avoid the pollen. However, I know that can be impossible because it's in your day-to-day. You can't really operate in your life without avoiding the pollen. From my experience, usually the thing that helps the patient the most is a stronger antihistamine, namely something called Fexofenadine. And actually, recently you can buy this over the counter. It's called Alevea. Just make sure you haven't got any allergies or any risk in taking this medication. Now, you're probably thinking, what kind of things can I do to help combat my hay fever? Now, I normally split this into two things that you can do and things that we can do. So if I talk about things that you can do, simple measures. So if you're having to leave the house and you can't avoid the pollen at all, things that you can do is apply some Vaseline around your nose, around your eyebrows. Appreciate it can mess up your look if you've got Vaseline in your eyebrows. But what that does is traps the pollen. It stops it getting inhaled through your nose and it stops it going into your eyes. Okay, some people even use a face mask to stop it going through your mouth. That's one. Number two, what you should do is not to leave your windows open in your bedroom or your house because the pollens will enter in your house. So when you're coming back in after a long day or you're in school, it's going to trigger your symptoms. The third thing is if you are out and about and you can't avoid that, when you get into the house, there's a few things you must do immediately. Firstly, get into the shower, wash your hair. The clothes that you've been wearing those days, they go straight into the wash. Remember, the pollen's sitting all over there, it's sitting in your hair, and by washing and removing your clothes before you go into your bedroom or your living area, you're going to stop the pollen from being in your household. Especially with your windows being shut, that will really help with your symptoms. The other things you can do, if your symptoms are still not well controlled and you've tried the Vaseline, you've tried wearing the sunglasses or even the face mask, there's some things that you can buy over the counter from a chemist. One is hay fever tablets, so antihistamines. They can help reduce your immune response to the hay fever. It can be very helpful. And remember, we find that Fexofenadine or Alevea is one of the better ones. Number two, you can get a nasal spray. There's different types of nasal spray, but usually the steroid nasal spray seems to be one of the better ones to help with your hay fever symptoms. You just need to make sure it's appropriate for you and with your health conditions, and a pharmacist can advise you on this as well. Now I know what you're thinking. You've tried the Vaseline, you've tried the nasal spray, the hay fever tablets, you've done all the washing and taking your clothes away when you come in for the doors, and you still got the symptoms and you must be really frustrated. So what could we do for you if you came to see us as your GP? Well, there's a few things that we can do for you. We can give you the higher dose of the Fexofenadine. Usually it comes in 120 milligrams, but we can give you the 180 milligrams. We can also change your nasal spray. So the type that you can buy over the counter from the pharmacy is decent, it can help, but we can give stronger versions of this that can be a lot more effective as well.
What is the hay fever injection and does it work?
Now this is a question a lot of my patients have asked me. They've seen a couple of aesthetic clinics providing this on the local market and they wonder, can they get it in the NHS, one, and does it even work? Well, from an NHS perspective, there's no evidence to say that actually it works. And you won't find your GPs giving you an injection for hay fever type treatment. Some patients swear by it, but generally speaking, we don't recommend a hay fever injection. We advise you to try the other methods that's mentioned in this video.